So some additional proposals, county side, recognizing that all organizations and programs are unique. This chart attempts to look and ask certain questions to organizations, service providers, to begin reformulating services and efforts along the lines of integrated care and a continuum of care. And so we're looking at where services received, looking at receiving services from the community, supporting hopefully engagement with site visits, then office visits. And so as an individual moves through that continuum, then more intense efforts can then be redeployed to individuals that are more acute need for healthcare support, but they're in the community and they're not engaged in services at all. And health status from acute to chronic to stabilized. Where do we provide services? So a continuum. Example proposed here: streets, shelters, hospitals, to respite beds, to treatment facilities, to stabilizing and transitional housing, and in more stable housing models. And what teams? So again, this is looking within an organization and across organizations in the downtown east side. So beginning with mobile teams, ACT teams, the ICM teams. There was quite a few mentions of care coordinators to coordinate care across the continuum. But there's also the recognition that different teams have key responsibilities within specific areas of the continuum as well. In addition, there was also mention of peer support services, expert specialists, site teams, and health authorities. So this is just examples of how a team-based continuum across the continuum of care could be formulated, realizing that there's a lot of coordination across the continuum, and so it's actually difficult to just say one team specifically focuses on one end of the continuum versus the other. So access regarding services, so no barrier versus low barrier, and then service lines, so special groups. And in the report, women, housing, addictions, youth. So the report was particularly emphasizing the need to focus on continuum of care, integrated care for those groups. Supported by training, coordinated with drop-in centers, coordinated with case coordinators, supported by mobile teams and outreach. So we're talking about communication and feedback mechanisms and integrated services. So the next couple examples just provide recommendations regarding an organization services already in place. So we're looking at mobile services versus site-based services. So, from mobile needle exchange coordinated with a mobile access project, and then at needle exchange, which provides alley and street safety patrols and the PSS services in the community. But site-based, so in-site, on-site, needle exchange, CTCT, Aboriginal Health Services, the food program, Unity Housing, and transition goals. So moving from acute health to chronic health to stable, or homeless to housed to stable housing, not engaged services to engaged to stable. So again, looking at integrated services, continuum-based services, coordinated services within an organization, across programs, across organizations. So concluding remarks, just trying to bring this complex 42-page report back to a few brief points. So really what they're emphasizing here from feedback from service providers and stakeholders and clients in the downtown east side was emphasizing a continuum of services and integrating services for that individual across the continuum so that engagement isn't lost. Feedback mechanisms to improve on services, evaluate services, and improve upon services. Identify standards and best practices so that our efforts are allocated to doing what we already know works. And cross-training, so that when a client engages one service provider versus another, that we all have the skills needed in order to address their needs. Central referral and coordination of services, serving in place. So looking at it from a continuum perspective in the community versus hospital versus transitional housing versus stable housing. Measuring performance outcomes and expanding critical services. So I hope you've found this review to be helpful. The health systems framework certainly represents an integrated and robust way to support individuals on the downtown east side, and I look forward to continuing this conversation with the stakeholders.